field of cerebral small vessel disease is a very huge field because and challenging because it includes a very huge and complex clinical phenotype and neurological phenotype, ranging from lacunar stroke, hemorrhagic stroke, and white matter hyperintensities and microbleeds. And the genetic of small vessel disease is very complex because it includes not only monogenic disorders but also polygenic disorders, and it's also complicated by cerebrovascular risk factor, common risk factor that underline other polygenic risk factors. So the picture is very complex, and I focused my presentation on the monogenic disorder associated with stroke that are rare, but it is important to make the diagnosis because you can implement some specific management measure and also therapeutic measure when available. The diseases are rare, so it is extremely necessary to joint series and the population and to make a joint effort to understand both the pathogenesis of the disease, to understand also the clinical course and the clinical features of the disorders, and also to implement clinical trials. And there are some available registries both in Europe and in US and in China, for instance for CADASIL or Fabry disease, but there are some other diseases more rare that for which the registries are missing. And one possibility is the emerging ERN, that is European Network for Rare Disorders, and there is a specific ERN named Neurovasc, and we started with two rare diseases. One is genetic, is CADASIL, and the other one is moyamoya, that is not genetic. But the idea is to have some data that can be shared between centers, and we can put together a European registry to have data to define better the clinical feature of the disease and also to implement studies. The importance of putting together data is to develop neuroimaging studies or also clinical studies to define better what are the aspects of the disease, because the most important difficulty is that some diseases are overlapping and the phenotype is very, very heterogeneous. And we can also have a detailed database and can be used to different kind of studies, for instance, including psychiatric disorders associated with the disease, cognitive disorders, epilepsy, and other manifestations that are not only stroke. And the other possibility is to use the registry to find patients to be treated in some kind of trials.